Hello, I'm Harsha Bhogle. I'm not here today as a cricket commentator or as someone you've seen over the years, no. I'm here today because I want to draw your attention to something that I believe is very important. Those children that you saw just now, they're not normal. They don't have the privilege of leading normal lives like you and I do. And that is because they have thalassemia major. So how many of you know about thalassemia? To be honest, I didn't know much either. We tend not to know things that don't affect us personally, and I was lucky not to have to know about it, but now I think I should have. Then I met Dr. Suman Jain. And she started to tell me things about thalassemia that started to affect me. You must be wondering, is this some disease that I'm talking about? It is indeed, because thalassemia can affect you in many ways. Let's find out a little more from Dr. Suman Jain.
Hello Harsha, I'm very happy you are associated with the cause of Thalassemia Sickle Cell Society.
Hello, Dr. Jain. No, actually, I think I should thank you for telling me a lot more about thalassemia, but do tell our viewers as much as you can about what we can do about thalassemia.
Thalassemia is a inherited, preventable, serious genetic blood disorder. In this disorder, body is not able to make and healthy hemoglobin, and the child needs hemoglobin to carry oxygen. In return, it gives energy.
So that means it's a preventive genetic disorder. So do tell us a little bit more about how to prevent it and treat it.
In this disorder, the child is not able to make a healthy hemoglobin, and the function of hemoglobin to carry oxygen from one cell to another cell. In return, it gives energy. So for the survival of these children, they need blood transfusion every 2 to 3 weeks so that their hemoglobin is maintained between 9 to 9.5 gram %. And with each unit of blood transfusion, the child gets iron overload. One unit gives around 250 milligram of iron, and this iron has to be removed from the body, and it is a very expensive disorder.
It's wonderful to know that your society started with treating 20 children with thalassemia, and now you're reaching out to 2,500. That must make you very proud.
I won't say it is remarkable, because there are many more children who are undiagnosed and who are not coming to the society. They die without getting the proper treatment. So lot of awareness is needed. Not a single children come to the society, I will be very happy, because it is a preventable disorder.
So you mean to say that if it is diagnosed within 6 weeks to 2 years, a child can actually lead a normal life?
Maintain these children, they need blood transfusion every 2 to 3 weeks to maintain their hemoglobin 9 gram %. And in return, when they get a unit of blood transfusion, they also get iron. So iron has to be removed from the body, and these drugs are very expensive. So this disease, when it is preventable, the awareness is required in the community so that they can do their test before getting married.
Dr. Jain, you were saying that the government should take the initiative and make thalassemia testing mandatory.
The government to come with us for creating awareness at the grassroots level. So now how the HIV incidence has come down, and how the polio has been prevented, immunization has been completed 100%. Similar way, this awareness is required, so many more people will come for HbA2 testing before marriage so that we can prevent this disorder completely. How the other countries have done it, like Cyprus and Sardinia, they have controlled this disorder by the government order by making this test mandatory before marriage.
Whether it's at fertility clinics, at childbirth clinics, at gynecologists, but it should be made mandatory.
Yes, it is very important. Awareness is very much required in the gynecologist, because they are not very keen to allow the parents to go for this test, because it's a preventable disorder, and once the mother is diagnosed as a thalassemia carrier, then husband also has to be tested. And if both of them they are carrier, then prenatal diagnosis can be done. And it is ethical, if the fetus is a thalassemia major, they can go for an abortion. Because in infertility clinic, the people have to spend such a lot, and many more children are born because they don't do this test, and the sperm, the donor is a carrier, and once the carrier is getting with the carrier of thalassemia major mother, then the child will be thalassemia major. So we have got around 2 to 3 children who are born because of infertility treatment.
So what are the difficulties that you face if a patient is diagnosed with thalassemia?
The difficulty once the child is being diagnosed is where to send the patient. So there are only our society which has been formed in 1998, and there are still more societies to be there so who can take control of these thalassemia children and manage these thalassemia children. This is the one point. And second is the blood, availability of blood. So availability of blood is very, very important. Though we can get major groups of blood, but the rare groups of blood is very difficult.
So isn't Sai Ramya a winner? As far as I'm concerned, she's an achiever.
Now I'm going to introduce one of my patients. She's coming to our society since 6 years of age.
Hi, I'm Ramya. I'm 19 years old. I'm a thalassemia major. Right from 6 years, I have joined this society, and last 14 years I'm coming to this society, and I'm transfusing blood. As thalassemia is a preventable disease, making awareness in the society is very important.
So let's go and meet some other children who are thalassemic and whose parents are leading a normal life. All thanks to the Thalassemia and Sickle Cell Society. I remember you telling me about the 10 million drive. Can you tell me a little more about what you're doing to raise awareness for it?
I appeal to the government to come forward and support this cause for creating awareness, and also to the people to come forward to donate blood very freely, and it is very safe to donate blood once in 3 months. And also to contribute to the cause of the society as a volunteer. They can give their time, they can give their money to create awareness and also to take care of this children.
I'm Harsha Bhogle and I support Mission 10 Million, the Thalassemia Awareness Drive. What could be more noble than saving a life? Believe in humanity. Believe in saving lives. Let's all work together and improve people's lives, bring a smile to their faces by raising awareness about thalassemia through Mission 10 Million. I believe in humanity. I believe in contributing. Don't you? Take a little bit of time out. Find out a little bit more. Go to www.tscs.in and do join the movement. Please support thalassemia majors by contributing your time, your money, your blood to help someone lead a better life.
For more details, log on to www.tscs.in. Eradicate thalassemia. Join us in saving next generation. Mission 10 Million at Thalassemia Awareness Drive. Supported by